Coronaviruses are RNA viruses that can infect humans and a wide variety of animal species. They cause a wide variety of respiratory infections, ranging from the common cold to pneumonia in humans. Coronaviruses in the autumn and winter every year cause a cold with a sore throat, dry cough, runny nose, weakness and fatigue. The incubation period is 3 to 5 days. In such coronavirus infections, the disease is self-limited within 4 to 6 days and patients recover quickly. In very few cases, and especially in the risk group, pneumonia may develop. The new coronavirus species, which have started to appear since 2002, have started to manifest themselves with a more severe respiratory tract infection similar to the flu. The first of these is SARS-CoV, Severe Acute Respiratory Syndrome Coronavirus, Severe Acute Respiratory Failure Syndrome, Coronavirus infection. In February 2003, the disease, which is thought to be transmitted from bats to palm musk cat and humans from here, in the Guangdong region of China, has affected 8,000 people in 33 countries from 5 continents, mostly from China, and approximately 800 people have died from this disease. After 2004, there is no new case report related to SARS. Another new coronavirus infection is MERS-CoV, Middle East Respiratory Syndrome Coronavirus infection. It started for the first time in 2012 from Saudi Arabia. This different MERS-CoV epidemic, which was transmitted from camel to person and continued until June 2018, was detected in 2,229 cases in 5 continents and 27 different countries. 791 of the cases were lost. Mortality rate in SARS-CoV has reached 35% in MERS-CoV. In both SARS-CoV and MERS-CoV infections, the incubation period can be as short as 3 to 5 days, and this period can be extended up to 10 to 14 days. This means that you can transmit the disease to others for up to 10 to 14 days before the disease symptoms appear. After the incubation period, the disease progresses with complaints of high fever, sore throat, dry cough, respiratory failure, muscle and joint pain, and headache. Since the disease mostly causes damage in the lower respiratory tract, pneumonia occurs more frequently, and this reaches a life-threatening level, especially in elderly patients considered to be a risk group, or those with underlying chronic heart, lung, and kidney disease. In those who recover from the disease, the healing process can take 7 to 10 days. In coronavirus infections that progress as a cold, the virus infects the ciliated epithelial cells in the nasopharynx through the aminopeptidase N receptor or sialic acid receptors. As the virus replicates, damage to the ciliated flat epithelial cells develops. Secreted chemokines and interleukins cause local complaints to develop. SARS-CoV and MERS-CoV bind to the respiratory tract cells via angiotensin-converting enzyme 2. This causes systemic infectious disease. The virus can also pass to pneumocytes, blood, urine, up to 2 months, and feces. The virus can be found in the respiratory tract for 2 to 3 weeks. The case, which was reported in Wuhan City with 11 million population in Hubei province in China on December 31, 2019, has been found to be infected with a new coronavirus that has never been seen before. This virus, called 2019 nCoV, is also thought to be transmitted from a zoonotic infection such as SARS-CoV and MERS-CoV, that is, from animals to humans. Nowadays, the disease has been transmitted from person to person, and on January 30, 2020, the number of cases has reached 8,000 cases, mostly in Hubei province and especially in Wuhan and in 19 countries outside China, and 170 cases have died, all in China. When the patients who lost their lives were examined, the majority of them were found to be elderly patients or patients diagnosed with chronic heart, lung and kidney, Parkinson's and diabetes. What is 2019 nCoV infection path? This infection, which started in the city of Wuhan, is thought to be transmitted from the market where seafood and various wild animal meat products are also sold. The disease has now been proven to be transmitted from person to person. Infection has so far been seen mostly in the same family or environment as the patient and in healthcare workers who have not taken droplet measures. Contagion usually occurs during the cough and sneezing of the sick person, in close contact up to 1 meter, and when unprotected persons enter the airways. 2019 Will nCoV continue to live in the environment? Within the framework of current information, it is accepted that 2019 nCoV is not likely to infect inanimate surfaces in the outdoor environment by hand after contact with hands, but after washing with live or lifeless surfaces with hands. Washing hands or cleaning with alcohol-based hand disinfectants and lifeless wiping of surfaces should not be neglected. What are the symptoms of 2019 nCoV? Currently known as cough, high fever and respiratory distress in infected cases, respiratory failure, kidney failure and life-threatening multi-organ failure may develop in severe cases. Who is sick? The 2019 nCoV infection tends to be more severe and life-threatening in older patients or those with underlying chronic heart disease, lung disease, chronic kidney and liver disease, as in seasonal influenza. How can the disease progress? Within the framework of current information, it is not possible to make a definite opinion about how and at what speed the disease can progress. However, studies on this are continuing. The disease may also begin to occur in regions or countries where the disease has not been previously seen. The number of patients may even increase significantly, but this does not mean that the disease will progress more severely or at a higher rate of death. How to approach possible or definitive patients? Patients in Hubei province of China, where the disease started in the last 14 days, and especially in Wuhan city, who have high fever, dry cough and breathing difficulties are possible cases, and these cases are identified as the definitive case with microbiological method. Rather than the fact that such cases go directly to the health institution, it is important to inform the health institution over the phone and make the preliminary evaluations by the health teams in their homes to prevent the spread of the infection in the community. Cases to be evaluated at home should wear a mask to cover their mouths and noses, and the healthcare team should evaluate the case by wearing high protective masks, gloves and other protective equipment. It is among the approaches that patients who will require hospitalization are brought to the healthcare facility with a mask, and patients with possible and/or definite 2019 nCoV infection should be hospitalized in negative pressure rooms, and the healthcare team that will serve it should be separated. Is there a treatment for corona disease? There are currently no antiviral drugs to treat the disease. Antiviral drugs used in the treatment of other viral infections have also been tried in the treatment of coronavirus infections, but an effective result has not been achieved. For now, treatment is symptomatic. Bed rest, abundant fluid consumption and daily calorie intake are essential for body resistance. Because it is the body resistance that will treat the disease.